AMCH, it's an NGO that addresses the unacceptably high mortality of mothers and their babies in Nigeria and beyond. We have the vision to reduce the maternal and neonatal mortality to levels that are significantly low enough, like the industrialized countries, and we want to ensure that these deaths do not take place anymore. AMCH is the acronym happening for our foundation's name, and it is ABIE Maternal and Child Health. AMCH was founded in the year 2013. But before then, AMCH was officially working without properly constituted as such. So we had taken some doctors to India to do some advanced newborn resuscitation course and observation on emergency care in the high intensive care for the newborn. So we can say that our history is actually before the 2013 registration that we have. So we can say that it will be important for me to let you know that the 4 main objectives of AMCH is, 1, to train healthcare workers, particularly in the frontline healthcare workers in the communities, and then to also ensure that they are current in frontline healthcare workers, the evidence-based interventions that reduce both maternal and newborn deaths. We advocate for newborn health with the governments, both at the local and the national level. We also do public awareness using the WHO Health Days. We make the public to realize that, for instance, breastfeeding is important, the significance of breastfeeding, the significance of taking care of premature babies. So we have yearly organized activities to commemorate these WHO days. So we've done quite a number of trainings. So we trainings as well as collaboration with other NGOs. These WHO days. We collaborated with the Akins, who had a grant from the Rotary International Club of California to do a training. So we trained in Ekpe. We trained healthcare workers in Ekpe and Ibejuleki under the sponsorship of Rotary Club of California that did this training. So we repeated what we had done in Ikorodu. Now it was a little broader because it was not just helping babies breathe. We did what we call the essential newborn care course. So since then, we've been doing it almost on a yearly basis. We've been to other locations to do this training. We have done it in Ifakojaye, in Ujokoro. We have done it also in Alimosho. So AMCH has been training frontline healthcare workers on essential newborn care over the years. So AMCH.
So in front of Blunting, we see one color that says danger sign. We are going to sample that danger sign. So when I look at the form, I will know that that baby has grunting. Am I making sense? Now, as you progress, you will get to a particular, you see where you have to take temperature. You see where you have to check the color of the baby.
I attended the Helping Babies Breathe program in the year 2018.
I attended the training in May 2018.
I attended the training in year 2019.
I attended the training in October 2019.
It was an educative program.
The training was highly effective. The program was really inspiring, and I learned, I relearned, and I unlearned. I unlearned that you don't have to clean The baby's Vanis caseosa. Immediately the baby is born, you don't have to clean it off. You have to leave it because it helps the baby to prevent infection and help the baby's skin. Well, so I learned that to clean it
Before the training, there are so many things we were doing wrongly. For instance, immediately we deliver a baby within 24 hours. Before clean, there are so many things we were doing wrongly. But part of the training, for instance, immediately we keep the baby warm, deliver a baby within 24 hours. So we don't bathe the new babies again. And there are so many things we were doing wrongly now. So it has but part of the training cells. We should keep the baby our orientation hours, and it is so what we are still practicing presently.
Before the training,
there are so many things we were doing.
What we are doing here
but part of the training cells,
okay. So we and after the training, we imbibe the knowledge before the training into our practice. What we are doing is, cells. And after the training, before the training. When we deliver baby like that, and after the training, if they couldn't breathe very well, we do assist them before the training by rubbing their back, by tapping, by giving. When we deliver baby like that, prescribed if they couldn't breathe very well, we do assist them.
I was trained 2018 August.
When we deliver baby
before
like
the
that,
training,
prescribed by the doctor.
You know, we just deliver baby.
We do assist them training
to climb the cord. We won't even wait. We
when
just
we
climb
deliver,
but after the before the training, a lot of changes. You know, we just deliver baby. We follow what we've been trained. The rate at which we just climb but after birth, a lot of changes reduce occur because we follow what we've been trained on. That is the rate at which they wait. You just climb some but after birth, after the training, it reduces a lot of changes as so many occur because we follow what we've been trained on. A lot of changes as so many occur because we follow what we've been trained on.
It was a practical training, and it has assisted me in neonatal resuscitation, helping babies breathe, and prompt intervention.
So AMCH has been in the background in those training. So we first of all had a TOT, training of trainers, in which we trained 48 healthcare workers who now were facilitators to step down the training to the other healthcare workers, and some private hospitals also had the benefit of getting this training.
A lot of us underwent the training, so we did a step-down training, and a lot of the changes that we were taught, the new things that we were taught, we introduced it to our colleagues too, and they embraced it, and I can say that impact has been positive even since that time till now.
Me and others that we attended, we did a step-down training then, and because the thing is part of us now, it is part of what we give to the new ones too. So it is part of our normal day routine.
After the training, when we came back, we had a step-down training. Initially, we had a step-down training with the help of the MD, with the doctors first. Then since the training was attended by nurses and doctors, later we had a joint one with the doctors and the nurses. And with that, we were able to cascade the training to a lot of nurses and doctors, and they too, they had a step-down during ward rounds, during deliveries, and we were able to carry a lot of people along.
Well, these trainings have helped to reduce neonatal deaths. Because being a pediatrician, our emphasis has been more on training for the newborn. And we have seen a death reduction of over 20% in the areas that we had trainings. Ekpe and Ibejuleki are hard-to-reach areas, and it was nice to be able to get there with this training. And you know, we also had significant impact because communities there were used to traditional birth attendants, even though the hospital CMD had been interacting with the TBAs. So it was good to...
Samuel Sonny lórúkọ tèmi, TBA ni mí, iṣẹ́ agbẹ̀bí ìbílẹ̀.
So it was good to...
So a ti wà lórí iṣẹ́ yìí láti 81 mo ti bẹ̀rẹ̀. Tí mo ti wà lọ́dọ̀ àwọn òbí tó bí mi ti kọ́ṣẹ́. A ti wà lórí iṣẹ́ yìí láti... Ìdí táwọn èèyàn fi ń lo TBA àkọ́kọ́ asúnmọ́ra jà wọn tó wà lọ́sítù lọ. Ilé làwa wà. Àkọ́kọ́ ẹlẹ́ẹ̀kejì nínú àjà wọn tó wà lọ́sítù. Àwọn kankan wà tá a máa ń ṣe fúnra wa. Ẹlòmíràn lè jẹ́ pé nǹkan ń ṣe ní emergency kó máa sáré wá kó tó dé. Àjà wọn tó wà lọ́sítù. Àdáhùn lóhùn wọn máa ṣe. Tó bá débi a máa tètè àtẹ́wà sí i. Ti kọ́ṣẹ́. Ṣé àwọn gbẹgbà COVID àwọn àdáhùn lóhùn wọn máa ṣe. Nàìjíríà ní problem kì í ṣe agboléyàn kan ni ò ní problem. Nàìjíríà a dẹ̀ ní problem náà torí àìmọye àwọn ẹlòmíì láti help tó sówó. Nàìjíríà a dẹ̀ ní problem náà àti bí èèyàn tó pọ̀ torí tó sì jíjẹ àti mímu fẹ́ dùn. A máa help ara wa láti help tó sówó torí pé ẹlòmíì máa tán bímọ tán gbówó lọ́gàn. Tábà tó sì jíjẹ àti mímu fẹ́ dùn bọ̀ sí jíjẹ. Ṣé o lè sọ pé dandan a máa help ara wa gan gbà yẹn torí pé ẹlòmíì máa bímọ ẹ sọ́fà wa gan tá a ti gbowó ṣòro tó tẹ̀ sí jíjẹ ṣé o lè sọ a máa help ara wa gan gbà yẹn torí pé ẹlòmíì máa bímọ. so àwọn kan tá a nídìí pọ̀ àdẹ̀rí help kankan pẹ̀lú ẹ̀ wọ́n lè nídìí ládùúgbò náà tó pọ̀ pé a máa help ara wa gan gbà yẹn torí pé ẹlòmíì máa bímọ. Hospital náà ni kí lórúkọ ẹ̀mí wọn ti wà maternity so help náà ìwà táwọn èèyàn wa náà nídìí tó pọ̀ gan so táwa náà nídìí nínú ẹ̀ so àwọn èèyàn wa náà lélẹ̀ tí àwọn kan tí wọ́n nídìí so báyìí nìkan ṣe rè so àwọn kan tí wọ́n nídìí wọ́n kọ́ wa lóríṣiríṣi àwọn kan bá ṣe lè ṣe nìkan ṣe rè iṣẹ́ ìgbẹ̀bí yẹn àti àwọn tá a kọ́ pọ̀ mọ́tótó wọ́n nídìí so ó ṣe pàtàkì ní àkọ́kọ́ iṣẹ́ ìgbẹ̀bí yẹn kọ́ wa lórí iṣu yẹn ni àwọn tá ìyẹn náà ìmọ́tótó àwọn iṣẹ́ bá ṣe lè ṣiṣẹ́ tó bá kù díẹ̀ ká tó nǹkan tán kan fi tí iṣẹ́ yẹn bá fẹ́ lẹ́yìn yẹn náà ṣe kíní díẹ̀ wọ́n ní ká rìfà so iṣẹ́ yẹn ká dẹ̀ máa ní àkọsílẹ̀ fún bá kù díẹ̀ ká tó tá a bá ti rìfà ẹ̀ tí iṣẹ́ yẹn bá fẹ́ pé ibi tá a rìfà ẹ̀ lọ àmọ̀bẹ̀ wọ́n ní ká rìfà àbá wọn sọ̀rọ̀ iṣẹ́ yẹn ẹni ẹ̀dẹ̀ wà láì máa ní àkọsílẹ̀ fún iṣẹ́ tá a bá ti rìfà ẹ̀ safe ká make sure pé ibi tá a rìfà ẹ̀ lọ àmọ̀bẹ̀ wọ́n ní ká rìfà.
Traditional birth attendants are also important because we cannot, if this is our environment, community, we cannot rule them out. But also, if they can be trained separately, traditional birth attendants are also it will be beneficial because we have a lot of infant mortality coming from traditional birth attendants, so they need the training. Yes, it will be beneficial to the TBAs. Traditional birth attendant because we already told them to know their limits, but they still go about still doing what they are not supposed to do. So I think this training should extend to them to be able to just baby and let them know when to know their limits.
So it was good to reach the most needed indigents of Ekpe and Ibejuleki, since it was already established that they had some interactions with the TBAs, so they could use the skill not only in the hospital but also in the community. So the other thing is that we've taught them to do early and prompt referral of patients, but also to be able to identify danger signs. And when these danger signs are identified, they now know to be selective in which babies are delivered in their facilities and help mothers to be referred promptly and early. So that has brought down the cases of perinatal asphyxia. It has brought down the newborn death rates that we have seen. The
The training had effect on mortality because I work in the theatre. It really helped it reduce it. Only few people had training on helping babies breathe. But immediately after the training, there was changes. I will give it a 5 out of 5.
I will rate the training very high because it's very educative and also has some skill that we use in performing to help the baby breathe.
The impact is very, very effective, very good. The mortality rate reduced.
Yes, it has a very positive effect on mortality rate.
It has impacted a lot because when this hospital was under
the mortality rate reduced,
they were giving award. The Obs and Gynae team and the pediatric team were giving a lot of awards because they had low mortality rate.
I will give kudos to them. They tried and they are trying, and they should keep on trying.
For the organizers, I will tell them, well done.
I will give
they are doing a
kudos to
fantastic job. They should keep it up.
They tried and they are trying.
Yes, there should be a periodic ongoing as in training. Periodic. You should not. For the organizers, I will.
The final message that I have for the organizer of the
ABB
is they should retrain people like nurses, doctors, so that this skill will not be wasted.
And like giving a lot of awards.
Like quarterly, they can be coming and ask some questions like about the trainers, or set up some questionnaires for the trainers.
Like why the more training will be needed is like this institution, for instance, nurses are not placed only in one ward. You can work in neonatal unit today and you are asked to go and work at general side. That is general. You can be in medical ward, surgery ward, auto ward. So if that person leaves that ward, we all shift, or the change just comes like January. So there is no always time for that other person that is taking over to learn. Though for like 5 or 6 years ago, we always make sure that out of 10, let's assume we have 10 nurses on a ward. If you are going to move, we move like 8. We'll leave 2 so that the 2 can at least step down some of the practices to the 8th one, but it has always been a tedious one.
The training, it should not be limited to few number of people. When the training, if you want to commence the training, you should go all out that, okay, in this institution, we want almost everybody and try to make up. It will not be, the training may not be once, maybe quarterly or something, but everybody, all health workers, people that are involved in the care of babies should have the training.
What I want from you people in the nearest future is, if you are going to retrain, they should get all the gadgets, everything that we are going to use. Everything should be at hand for us. It's not that we'll be running extra schedule for it. They should provide everything for us to use.
I would suggest that we have more hands-on practical sections with mannequins. This will make the training to stick better.
Yeah, you will notice that I have been talking about collaborations, because it's quite heavy in terms of the resources that you require. Talking about financial resources, you require mannequins, you require training equipment, and then you require logistics to get to these people. We also require materials that you'll need to print to do the training, like wall charts, provider booklets, and so on. So not only that, the TOTs are done as trainings with accommodation for facilitators. So you have to put them in hotels, you have to rent halls, and it's not cheap. AMC want to take the training further into communities. We have not reached so many parts of Lagos State, and we intend to do so, and beyond Lagos State as well. But the constraint has been funding. Particularly the TOT is expensive, and then having people to now go into facilities to do this high frequency, training with which is shaped to meet their specific needs would require more manpower and also more monitoring and evaluation, follow-up and training materials, because we will be doing so many at the same time. So we hope that we will find sponsors who will help push our work forward. We have collaborated with so many other people as an organization. We need to be able to stand and do this. Our collaborations have helped us, and sponsorship have come from kind-hearted Nigerians and organizations, but we need some more.